talk about peanut allergies. And over the last decade or so, we see that the peanut allergy is on the rise. And there was a new study in New England Journal of Medicine and talk about the fact that early exposure may actually be a good thing, and you can build up immunity against this. I think in this country, we're cleaning up. We're using a lot of detergents. We're, avoiding the bacteria and these bugs, so our immune system is not exposed to it. And then a few years in your fourth, fifth year of birth, all of a sudden you get exposed to allergies to peanut, and you have these allergies. What is your thought on this? And is early exposure a good way on how to avoid peanut allergies?
Yeah, I think it is now, because the old recommendation when it came to introducing foods to a baby and solid foods, and a solid food is considered anything other than breast milk or formula, the old recommendation was to wait on certain highly allergenic foods to introduce to them. And peanuts, as an example, used to be not until like age 2 or 3 was kind of the recommendation. And now they're thinking that probably was not the best advice, because what they found was that peanut allergies actually tripled between 1997 to 2008, and we don't really know why exactly. Genetics obviously could play a role, because food allergies do tend to run in families, but now the new recommendation is to actually start allergenic foods early, but not to make them the first food that you would give a baby. So once the baby's already established on, say, maybe some rice cereal or some fruits or vegetables, then you could maybe introduce like some peanut butter mixed with their cereal a little bit. And then watch for any allergic reactions within the first few minutes or even the first few hours afterwards, because most likely if they are truly allergic to it, they're going to have an allergic reaction within a few minutes, within a few hours. And the symptoms of that would be like breaking out in hives or welts, or maybe a skin rash. They may have a tummy upset, their eyes become itchy and red, their mouth may swell, their tongue could swell. So those would all be symptoms of that. But also, too, if you have food allergies that run in your family, do tell your pediatrician of that.
That's a good point.
He may have other ideas then exactly as to when to start that, but you do need to inform them of that.
We're talking to Cheryl Mussatto, and she's one of the contributors to our blog on samadimd.com. Writes unbelievable articles, extremely helpful. And Cheryl, I personally have learned a lot from you, from your articles, so I appreciate you being here. In this particular article, actually, they saw like 80% difference in kids that were exposed early. And a year before, there was another article from Israel that also showed the same exact thing, that when you expose the kids early on with peanut, they boost their immune system, and they don't have this aggressive allergic reactions. So what is the message to parents out there? Just talk to your doctors and experiment early on, right?
Yeah, I think so. And also, too, they're also encouraging women who are pregnant to go ahead and eat peanuts and some of those types of foods, so that when the baby is in utero inside the mother, that they're exposed to that already, and then, again, talk to your pediatrician after they're born to see what is their best advice on when to start this. And pretty much the American Academy of Pediatrics is also now recommending to wait until 6 months of age on starting solid foods for babies. But again, I think it's going to depend on individual babies too. But I think they're thinking that, you want to get the immune system exposed to these foods earlier than what we have been telling people, and that way the immune system gets more aware of them or used to them, so that they don't trigger these allergic reactions to them later on.